today, sir? My name is Lauren, and I'm going to be your nurse today. And we will be inserting a catheter as your doctor's ordered before your surgery. Okay. Okay, as I raise you up, I'm just going to check your wristband. Can you go ahead and tell me your first and last name, please? Okay, and what's your date of birth? Alright, well, Ms. Brody, like I said, we're going to be inserting a catheter today before your surgery so the doctor can monitor your intake, your output of urine during the surgery. So I'm just going to drape you back. And at this time, I had already washed my hands, put on clean gloves, and I would provide perineal care. After perineal care, I would remove my gloves and re-wash my hands. Now, Ms. Brody, do you have any allergies to latex, iodine, or betadine? No? Alrighty. Get this fresh rag going. Okay. I'm going to go ahead and drape you with the shiny side of the drape down. Okay, we are good to go. Put on sterile gloves. I'm just going to transfer my sterile field to the bed. Go ahead and connect my sterile water to my balloon port so it'll be ready when I need it. I'm going to take the betadine and put it all over the cotton swabs and discard. Now my non-dominant hand will remain on the penis for the rest of the procedure, and at any time during the procedure the sterility field would break, I'd start the process all over again. Okay, so I'm just going to clean the penis from the tip down the shaft. Okay, now I'm going to inject the lube into the tip of the penis. This might be a little cold, Mr. Brody, but you'll be okay. Alright, now I'm going to take my catheter and insert it into the Y junction. Okay, now I would secure it with my non-dominant hand, inflate the balloon, and remove the syringe from the port. Now I would attach the catheter to the patient's leg, leaving room for leg movement, making sure I connect the bag to the bed at a level lower than the bladder. And at this point, if I needed to collect a specimen, I could get it from the bag since it was just inserted. But if the catheter had been in for a while, I would clean the port with an alcohol swab, insert the syringe after clamping it, and draw back a sterile solution sample of urine to put it in the correct sterile container. So now I'm just going to go ahead and get everything up and out the way. Okay. And now I would remove my sterile gloves, perform hand hygiene, put on a new pair of clean gloves, and provide perineal care. After perineal care, I would recover the patient, making sure he wasn't in any discomfort, and then I would lower him back to a safe height and making sure the bed rails were up ×2. And then after this, I would document how the patient did during the procedure, what procedure was done, the size of the catheter, the characteristics of the urine, and the initial amount of urine that was discarded. doing today? Well, that's great. My name is Lauren, and I'm going to be your nurse today. And we are going to be removing your catheter as your doctor has ordered. Okay. Just going to raise you up. And as I'm doing that, I'm going to check your wristband. Can you go ahead and tell me your first and last name? Okay, and when's your birthday? Alright, thank you, Mr. Brady. Get you up. So I'm just going to uncover you, maintaining patient privacy during the procedure. I would empty the urine bag and dispose of it, and then I would take the output measurement if needed. After the bag was emptied, I would detach it from the leg, grabbing my syringe and inserting it into the balloon port, deflating the balloon, and then I would gently and slowly remove the catheter. Alright. See, that wasn't so bad. And then I would discard the contents in the proper container. And then I would provide peritoneal care as needed, and then I would recover the patient, putting him in the lowest position and then making sure his bed rails were up ×2. After that, I would discard my gloves, perform hand hygiene, and then document the removal of the catheter, how the patient tolerated it, and the characteristics of the urine.